Dolly from beautiful San Juan, Puerto Rico, where it is still t-shirt weather. We've all stubbed a toe or two and experienced pain. Maybe some ice, maybe some Tylenol is what it takes to keep it under control and manage it. But what about people with chronic pain, pain they can't get rid of? Their typical regimen involves some combination of learning to live with it and strong medication that comes with its own side effects. And joining me for our third Build with Dolly video are two people who will give us clinical and the business perspective on using artificial intelligence in the area of chronic pain relief. Imagine a world where your doctor prescribes you a virtual reality experience at the right dosage, and it somehow helps you manage your pain. And I'm here to tell you that you no longer have to imagine it because Harvard MedTech delivers exactly that. So without much further ado, let's meet Shan Padda, the Chief Operating Officer at Harvard MedTech.
Hi, Dolly.
Hi, so nice to see you today. Shan, tell us about your journey and how you decided to start Harvard MedTech and how you came up with the name for the company.
The fully transparent answer is this is my sixth company, and I ran out of names with naming my previous ones, and so I was trying to come up with a name last minute, and I went to Harvard. So I wanted to differentiate the company, and there's a lot of med tech companies out there. So I wanted to take advantage of the connotation of Harvard being smart. So the idea being that people would think, hey, this is a smart medtech company. So that's how I came up with the name. In terms of starting the company, every entrepreneur is different. For me, I'm very heavily mission driven. I'm not interested in just making money. I'm interested in making the world a better place. I want to make money in that process, but the primary motivation is making the world a better place. And so the problem I was trying to solve was the opioid epidemic. You may have read that even like last year, 100,000 people died from overdoses because of fentanyl and other opioids. So it's a big problem. More people have died from the opioid crisis than have died from the COVID pandemic. So as I looked at that, I said, okay, well, why do people take opioids? And the answer was, well, they do it to manage chronic pain. So then as I studied chronic pain, what became clear as you look at the brain, that really the chronic pain primarily comes from either one of two sources. Either there's a part of the brain called the thalamus, which if it's functioning normally, you have a normal level of pain. For people who have malfunctioning thalamuses, they're constantly measuring pain signals. So they think they're in more pain than they actually are. And so that's one problem. The other problem is that a lot of pain, chronic pain, comes from another part of the brain called the emotional center. And something really bad happens to you, like a traumatic incident, and then that gets into that part of the brain, and that part of the brain starts sending out pain signals that they're sort of fake pain signals. So it seemed to me that the real problem was that we have brains that are not functioning the way that they were intended to. And so I put together a combination of virtual reality and behavioral health therapy so that the virtual reality solves the problem of the thalamus by retraining it so that the patient has more control over it. And then the behavioral health sessions are meant to tackle the pain signals that are coming from the emotional part of the brain. So between those two modalities, you cover about 80% of chronic pain.
Wow, that's amazing. My biggest principle that I live by is like helping people and taking care of them. And in the future, I'm hoping to possibly go into the medical industry. So hearing something like that is very inspiring. And I'm thinking about like working with special needs children to see if I can figure out a way to bridge the gap in their mental disabilities and see if I can help them out with technology in that way. So thank you for sharing that. That's really cool.
Yeah, no, and that's a wonderful goal, Dolly. I respect you for having those aspirational goals. That's how we should lead our life, right? In terms of at the end of the day, what matters is, have we left the world a better place because we were a part of it or not? It's that simple. And if we can answer yes, then we have been a good citizen and we've been a good person to everyone else around us.
Thank you so much for sharing all that with me and Build with Dolly today. Now let's switch over to Dr. Gerry Stanley, Chief Medical Officer at Harvard MedTech. Hello, Dr. Stanley. Welcome to Build with Dolly. When rolling out a new form of intervention to pain like VR therapy, what gives physicians comfort in bringing it to their patients? And what are some of the objections that you face and hear on a regular basis?
Well, I think, the objections you face no matter what you do when something is new is the fact that it's new. By default, medicine as an industry moves very, very slowly. It's very glacial. It's kind of like the Queen Mary. It doesn't turn very quickly, which is great because that really drives safety and outcomes, and we get to look at metrics. Innovation, especially something like virtual reality, is a little bit more of a revolutionary shift. It feels like it's very fast, but virtual reality has been used in healthcare for the better part of a decade. Patients used to actually go to the hospital to actually use virtual reality. They're using virtual reality in burn units. The Department of Defense is using it for phantom limb pain and for transporting patients across the ocean. So it's established, but it's not what I would say is mainstream. We couple virtual reality with behavioral health. So behavioral health interventions using therapists to help guide the patient through the program. So most physicians are very comfortable with the fact that we're doing the behavioral health interventions. It's the addition of virtual reality that makes it new. The biggest thing that I get from a feedback standpoint with regards to doctors is, as they're looking at things that are new and they're innovative, the number one question the doctors always ask, and the doctors always should ask, is first and foremost, is it safe? And then the second question is it going to help? And the fact that we're non-invasive, we're non-pharmacologic, nothing goes in your body, there's no drugs that are being ingested, makes it an extraordinarily safe way for doctors to be a little bit more innovative. And then the fact that we're getting such good outcomes really helps the doctors feel like, okay, great, other doctors are using this. We've got journal articles that are published. So we know it's safe for our patients, and we know that it's been tried and tested and true elsewhere.
Thanks for talking to me today and taking the time.
Oh, it's absolutely my privilege, Dolly. Thank you for asking.
Thank you. Bye-bye.
Bye-bye.